Good day, I'm Crisamaybia Glibot from BSN 3D, and today I will be performing a return demonstration regarding priming of intravenous infusion. So, first thing to do is to verify the IV solution order on the MAR with the medical order. So, verifying order ensures that the correct IV solution and the rate of infusion as well as the medication will be administered. After verifying the order in the MAR, clarify any inconsistencies, check the patient's chart for any allergies, and check the IV solution for its color, or any leakage, or the expiration date. And then, know the techniques of IV insertion, precaution, and the purpose of IV administration and the medication if ordered. So, knowledge and skills is essential for safe and accurate IV and medication administration. Then gather all the equipments and bring it to the bedside, such as the IV solution, the infusion set, and a kidney basin. Having equipments available saves time and facilitates the accomplishment of the procedure. And then don't forget to perform hand hygiene and wear PPE if indicated. So, hand hygiene and PPE prevents the spread of microorganisms, and the PPE is required based on the transmission precaution. Then identify the patient. Identifying the patient ensures that the right patient receives the intervention, and it helps prevent errors. So after identifying the patient, close the curtains and the door if possible, and this is to ensure patient's privacy. And then explain what you're going to do to the patient and why you will do it to the patient, because it relieves anxiety and facilitates cooperation. And also don't forget to ask the patient about allergies to medication, tapes, or skin antiseptics as appropriate, since possible allergies may exist related to medication, tape, or local anesthetic. So, ma'am, do you have any allergies to medication, tapes, or local anesthetic?
No.
Okay. If considering using a local anesthetic, inquire about the allergies for these substances. So, the injectable anesthetic can result in allergic reaction and tissue damage. So, if using a local anesthetic, explain the rationale and procedure to the patient, and apply anesthetic to a few potential insertion sites, and allow sufficient time for the anesthetic to take effect. Explanation provides reassurance and facilitates the patient's cooperation, and local anesthetic decreases the pain felt at the insertion site, and some of the anesthetic take up to an hour to become effective. Now let's compare the IV container label with the MAR, and then remove the IV bag from the outer wrapper if indicated. Also, check for expiration date, and if possible, scan the barcode on the container. So checking the label with the MAR ensures that the right IV solution will be administered to the patient. And also, compare the patient identification band with the MAR. So, identifying the patient ensures that the right patient receives the intervention and helps prevent errors. Then, complete a time strip for the infusion and apply to the IV container. So, time strip allows for quick visual reference by the nurse to monitor infusion accuracy. So, let's just assume that this is a time strip, this one, and apply it here. And in handling the IV container as well as the infusion set, maintain aseptic technique while opening them, since it is essential for preventing the spread of microorganisms. Now let's continue. Remove administration set from the package. And then apply label to tubing, reflecting the day and date for next set change per facility guidelines. So, labeling tubing ensures adherence to facility policy regarding administration set changes and reduces the risk of spread of microorganisms. In general, IV tubing is changed every 72 to 96 hours. So, I'm gonna write here, start date is 1/25/2022 at 8:10 a.m. and 96 hours is about 3 days. 72 hours is about 3 days rather. So, I'll put here 1/28/2022 at 8:10 a.m. initials, and I'm gonna put it here in the tubing later. And now, let's close the roller clamp or the side clamp here in the IV administration set. So, clamping the IV tubing prevents air and fluid from entering the IV tubing at this time. So, let's close it. And now, after we close the clamp, let's invert the IV solution. Now it's inverted. And remove the cap on the edge side. So, let's assume that this is the cap. And taking care not to touch the exposed entry site here. So, inverting the container allows easy access to the entry site. And touching the open entry site on the IV container or the spike here results in contamination, and the container or the administration set would have to be discarded. And now, let us remove the cap from the spike. And by using twisting and pushing motion, insert the spike into the entry side of the container. And alternately follow the manufacturer's direction for insertion. So, inserting the spike punctures the seal in the container and allows access to the contents. After we put in the spike, let's hang the IV container on the IV pool and squeeze the drip chamber and fill at least halfway. And then squeeze this. And fill it at least halfway. So suction causes fluid to move into the drip chamber, and fluid prevents air from moving down the tubing. So after that, let us now open the clamp and allow fluid to flow until air bubbles have disappeared. So there are some instances that some tubing needs to be, there's a cap here and needs to be removed for the fluid to flow. So in removing it, maintain sterility to prevent contamination. And check the tubing if there are bubbles. So if there is no bubbles, let us now close the clamp. And when the tubing is primed with IV solution, close the clamp. And then recap the ending. So if air bubbles are not removed from the tubing, large amounts of air can act as an embolus. Now there is no bubbles. and the tubing is now primed with IV solution. So if an electronic device is to be used, follow the manufacturer's instruction for inserting the tubings into the device. So this is to ensure the proper use of the equipment. So this is how we prime and spike IV.